If you're currently dealing with foot pain, poor balance, and wobbly ankles, this video is just for you. I'm going to show you some yoga-inspired techniques that will help you to improve the strength and stability of your ankles and feet. These mindful movements will help us to activate the very muscles that keep you grounded. So let's get started. Welcome to the Joint Longevity Lab by Fitness Integrated Science. I'm Eirk, and I am a certified yoga therapist as well as a registered yoga teacher. I'm also a muscle activation technique certified specialist and personal trainer. And I know from the experiences that I've had working with students that the foot and ankle complex are some of the hardest places to train. One of the reasons for this is because we are stuck in shoes all the time and we are not used to dealing with our bare foot. Now, I love barefoot shoe technology, but I also love the fact that yoga, it requires you to take your shoes and socks off. Over the years, my feet have definitely changed for the positive by all the years that I have done yoga, but I remember the first time I did it, that was the most challenging aspect. I didn't realize how weak my feet actually were, even though I was only in my 20s when I started. So I invite you to do just that as we move through some of these postures. Don't worry if you've never had yoga experience. I'm going to talk you right through it. And I'm hoping that some of the techniques that I'm going to show you today that you can use in your warm-up and also in your cool-down to prevent ankle injuries and improve your balance. So I'm going to begin on the ground with a position called Dandasana, which is the staff pose. If you can't get on the ground, not to worry. You can sit in a chair and you can just move your feet as I talk you along. So the first thing I'm going to do is take both of the legs out in front of me and just try to straighten the knees. If you want to, you can put a blanket or a pillow or something like that under your hips so that your back does not feel discomfort. Place your hands beside you and let's just start by looking at the feet. Now, as you look at your feet, I want you to notice if your feet look the same. Maybe you have some bunions, maybe the toes are crossed, maybe you have curled toes. Whatever it is, I want you to notice if, in fact, your feet are the same from right to left. Now, as we begin to move the feet, I want you to drop the tops of the feet down. Now, this motion is called plantar flexion of the ankle, the subtalar joint. With plantar flexion, you're going to feel some tightening, some activation of your calf muscles, your gastrocnemius muscles. You're also going to feel some muscles engaging across the bottoms of your feet, and without me even having to tell you, you may notice that your toes are flexing forward. So I want you to hold that for just a minute and see if you have any cramping going on, and then just relax. Now, the opposite motion of that is going to be dorsiflexion. So let's just draw the tops of the feet back. You can spread your toes apart and feel the muscles that sit across the top of the foot and ankle so that you can activate muscles that cross your shins, your tibialis anterior. This is a part of pronation. This is where we absorb ground forces and walking. You'll also notice that your toes are coming back in extension. That's a normal part of that as well. So as you go back into plantar flexion, this is our supination part of gait. This is where we are really using ground forces to push off so that we can ambulate our body forward. This is where we have our propulsion phase of gait, where our strength comes in. So, and as you go back and forth now, I'm just going to increase my cadence. I want you to notice how your ankles are moving from one position to the next. How is your motion quality? Are your feet moving straight, or are they taking sort of a circular effect? This is going to be indicative of not only your muscular system, whether or not you're strong or weak, but also the condition of your joints, which some of that may be hereditary, some of that may just be wear and tear over time. Now, as you relax your ankles, let's focus on the toes themselves. As we curl them under, this position is called toe flexion. Toe flexion involves muscles that sit all across the bottoms of the feet and the toes, and you typically feel some cramping there. Then as you move back through toe extension, this is going to be engaging muscles across the tops of your feet. You may even notice the tendons coming right back up. So as you go from side to side, notice again how you're moving from left to right, moving through the toes. Now, this is an exercise I would definitely recommend you doing before and after an activity, and particularly if you've been standing all day, if you've been wearing some sort of awkward shoes where your feet are unable to move, these are great things to do. Now let's focus on another motion of the feet, abduction and adduction. So if I move my fingers apart, I can do the same thing with my toes, or can you? Look down at your feet, notice if that's something that you're capable of, and then I want you to move your toes together in adduction, adduction, and see if you can do that. And we actually have muscles in our feet that do that, right? So let's do that again as we separate those wide apart, seeing if their 2 feet are moving the same, and then moving those back together. So let's go ahead now and take ourselves up into a standing position. So I'm just going to work my legs over, tuck the toes under, walk the hands in, and push up into standing. Now having mobile feet will actually help you to get up and down off the floor, but as we move into our next posture called Tadasana, which is the mountain pose in yoga, this posture is great for detecting what's happening in our foot when the ground is pushing us into us. So what I want to do now is I want to take that big toe again and try to raise it off the floor all by itself. Now this great toe, this hallux joint, bears 60% of our weight at least, and we use it as a push-off mechanism in gait. It's very important. And here's the thing, when you're wearing arch supports all the time, that big toe is constantly locked in supination. We are unable to move and transform from pronation to supination, and it translates up into our knees, our hips, and all the way up into our spine. So now when you push that big toe down, can you lift the other 4 toes up? Now when you push that big toe on the floor, I want you to notice that longitudinal arch on the inside of the foot, that medial arch that runs from the big toe to the inside of the heel. When you put the 4 toes back down again and lift the big toe up, we're emphasizing the lateral arch in the foot, running from the little toe to the arch. So if we can go back and forth, we are activating muscles in the bottoms of the feet, the foot intrinsic region, that help us to sense the ground. Don't worry if you're unable to do this right away, or if at all. I know I've had people, bend over and hold their toes down to do it. What's important is that you're giving yourself the intention of doing this so that over time, as the brain to foot mechanism strengthens, these muscles get stronger, you will have more awareness of what's going on in your feet. Now if you just spread your toes apart, see if you can see the color of the mat in between your toes. That was that splaying open, that abduction of the toes. And I want you to think of shortening the arch. We're bringing the forefoot, the toes, towards the rear foot, the ankle and heel. And as we do this, we lift up that transverse arch in the bottoms of the feet. Now in yoga, we have a saying that we're standing on a tripod. From the inside of the foot, big toe, to the inner heel, to the outside of the foot, little toe, to the outer heel, making sort of a triangle. And I want you to rock your body weight back onto your heel. Notice how that action alone activates a lot of muscles in the back of the body. Just like if we come forward into the forefoot, we feel those muscles bracing us because we are falling forward. So moving into the heel of the foot, you may notice engagement of the abdominals, the fronts of the legs, and embracing at the back. And as we go forward, we may brace at the front and engage muscles in the back. This is really important to practice this in a controlled environment, because how many people you know actually face plant because their ankles are not able to absorb ground forces, they're knocked off their balance, and then boom, they're on the ground. So now let's move from standing to sitting. So we start from Tadasana and we move down into Uttanasana, which is the chair pose in yoga. As you squat, what you notice is that your arches will actually drop. And you can see that I have a big drop on this side. I've had 2 navicular bones since I was born, so it actually makes me very good at pronation on that foot, which is not great because I don't pronate as much on this foot. So it has definitely changed my mechanics over the years. But it's made me really good at squatting, and over the years, training muscles that cross the knee and hip has really protected my back. Now this is not the case for everybody. As you stand back up now, let's go back into that short foot as we draw the forefoot towards the rear foot. So for me, when I took ballet, I was unable to move into toe shoes very well because I didn't have the ability to supinate through the foot in that longitudinal arch and the transverse arch. And that really made it to where I couldn't become a prima ballerina, right? So at any rate, now I teach yoga. So on your inhale breath, I want you to lift up from your chest, pull up into your pelvic floor, and notice that is so much easier when we activate muscles in the feet. By the same token, when you go down into your chair pose and we collapse into pronation, we notice just the opposite happening. The torso starts to drop, the knees bend, the hips flex, and we start to internally rotate at the hip. So going back and forth through those will really help you to hone what's happening in your foot and ankle. Now let's try some poses that we can translate from moving into the ground to standing on one leg while we move our leg around our body. So if you notice, if I put my foot in front, it shifts me back. If I put my foot out to the side, it shifts me maybe over to here. And as I put that foot behind me, it shifts me forward. And we can't always predict when we're going to have to pick up something heavy, or when someone's going to push us over, or we're going to hit that spot in the street that's going to cause us to be off balance. So that's why I think it's so good to practice these in a controlled environment. So for the first pose, let's move into the pyramid pose. I'm just going to step one foot in front, and then I'm going to take my other foot and just slide it back, making sure that my feet stay hip width apart. From here, I'm going to notice how far I can move the heel into the ground. So I'm feeling my Achilles tendon stretching, but I'm really focusing on tightening the top of the foot. And if you notice that I max out here, I can't get any further to the floor, watch what I'm going to do. I'm going to externally rotate my hip just enough to be able to move the heel of the foot into the ground. Now already I am getting some awareness on the lateral aspect of my foot and all the way down to the heel. From here I'm just going to push that hip forward, squeezing the gluteal muscles in extension, and by the same token draw the top hip back so that I can move into hip flexion. Now when I do this, a lot of people tend to, because they have limited ability to flex their hips, they'll compensate by lifting the inside of their foot off the ground. So what I'm going to have you do now is spread your toes and push that big toe into the ground. Wow, do you feel that? It's almost like we have a spiraling action from the outer hip to the inside of the big toe. This is helping us to hone internal rotation while we flex the hips. So as we pull the forward leg back and the back leg forward, let's try to press into all 5 toes. You can feel that the back foot is very much more into dorsiflexion at the ankle, and because that foot is out in front of me, it is moving into plantar flexion. So there's a lot happening here. Now if I decide that I'm going to shift my center of mass and come forward over this foot, wow, I have more load now going into that foot. My requirements are much greater. And if I push into my big toe, moving the outer hip back, I am training both hip muscles and foot muscles at the same time. Now, if you come up off of that back toe and put more weight on this forward foot, you can really feel how that foot is pushing into the ground. Then as we shift back, we want to try to maintain that pressure as we go back into the heel. So this posture, although I know the goal of this pose is to get your head down to your shin, to me that doesn't matter. What's really cool about this posture is the alignment of the hip and the foot and the knee, and it is helping me to hone hip flexion. So now when I come into standing after doing that posture, I can move into a standing on one leg with my leg out in front of me, which in yoga is called Utthita, Hasta, Padangusthasana. Starting here, so I'm pushing into that back foot and maybe even translating into a long lever, working on strengthening that hip and then releasing that back down. Now another great pose that I really like is called the goddess pose. And the reason I like this because it really helps me to explore the frontal plane of the hip and how that translates into the foot. So let's just separate our feet wide apart, turning the hips outward naturally. The knees are going to mirror that, and then we want to try to angle the feet definitely to line up with what's happening at the knee joint. So if you would, dorsiflexing your toes, you're extending the toes, you're drawing the tops of your toes up to the tops of your feet. And notice when I do that, how it really lifts the arches off the ground. Then I'm going to spread the toes wide apart, and then I want you to put your toes back to the ground. But here's what I want you to do. I want you to try to maintain somewhat of a lift or somewhat of an arch right across that inside arch of the foot. So that is going to help me to put my pressure into the lateral aspect of the foot, from the little toe to the heel. What do you notice when you really emphasize that part of your foot? Now, I'm not saying take the pressure off of your big toe, but I am saying, can we draw some awareness to the lateral part of the foot? Do you notice how that automatically translates into muscles in the outer hip? This is so important for those of you that suffer from tight hips. Maybe you have some sciatic issues, having a hard time sitting in chairs or getting down the ground. This posture is really important to practice. You can also take your hands, place them on the backs of your legs, and add that little bit of pressure, creating a purposeful isometric contraction. And what you notice is that when the hips are moving better, I say moving, when the hips are firing better, they're not moving right now, we can even put more of our awareness into the lateral aspect of the foot. And if you have a hard time, your arches are coming down, you can still come into toe extension, spread your toes, and put your toes down on the ground, which is toe flexion. That action of toe flexion is plantar flexion, lifting the arch, and really feeling all four corners of the feet. Now when we practice that posture and we come back into our single leg standing, what do we notice? When we come into a posture like the tree pose, which is when we are actually moving this hip out to the side. We have trained our ability to abduct at the hip, so now when I place my foot somewhere on the inside of that leg, my ability to balance over that leg and really hone into where my center of mass is, which is kind of shifted this way a little bit, I'm feeling much, much stronger. This happens so often when you see, for instance, in baggage claim, where people are riding that train, they're moving from side to side, and they're not challenged their hips to become strong enough over their feet when they have lateral forces going through the hip. So this is a great opportunity to work on that. Now, from my last example, I want to try looking at extension of the hip. Sometimes we're pushed backwards. So what I'm going to do is I'm going to go into another posture called the Crescent lunge. Stepping one foot back, I'm actually going to come into toe extension, keeping my heel off the floor. Where you're like, that's just a lunge. Exactly. This is just a lunge. But here's what I'm going to do. Instead of coming over this forward leg, I'm going to shift my weight back over this back leg. So now I'm going to squeeze into the gluteal muscles of that back foot. This helps me to really draw some awareness of my hip complex. Now when you're here, I want you to notice that I'm shifting my weight off of my forward foot. So I'm putting my pressure into the heel of this foot here. I'm back into my rear foot. Now what I want to do as I move into this, working on ankle mobility, I'm just going to shift my weight over that foot. So now as I shift my weight over that foot, I'm coming into ankle dorsiflexion. I'm bending over that leg. Squeezing into that back glute now, I'm just going to translate that and rise up through the chest. So now I'm honing gluteals, lower back, chest, and I'm really working on ankle dorsiflexion. What does ankle dorsiflexion? That foot is pushing into the ground is pushing into the foot, my knee is coming out over my ankle a little bit. I'm really working on the muscles that cross the top of the ankle. This is going to help us to hone muscles that cross the knee and the hip. So now when I come into standing on one leg, for instance, coming forward, and my leg is behind me, I'm strengthening muscles in the posterior chain, the back, the hip, the hamstring, and because my ankle dorsiflexion is now stronger, my ability to straighten my knee and also flex at my hip is much, much better, so that when I go into postures such as Warrior III, it is much, much easier. Now, when we come back out of that posture and we move back into the warrior pose, you're going to feel even more balanced. Now, all of these postures will really help you to work on standing on one leg. And you can see that if my leg is out in front of me, it's going to shift me to the back. If my leg is out to the side, it's going to shift me to the outside. And if my leg is behind me, it's going to shift me forward. So practicing those three poses, left to right, continuously observing how your body is performing will absolutely help you to improve your balance and reduce ankle pain. Now, if this video spoke to you and you learned something, please give me a thumbs up and share it with your friends, anyone that you know that I can help. If you'd like more help guiding you through classes that really take in these principles, head over to Fitness Integrated Science TV, where I dive into a lot of these postures from a biomechanical standpoint, looking at the effect of isometrics. Thank you so much for watching, and I'll see you next time.